Can a knee support brace help improve patellofemoral pain syndrome? Well, let's first talk about how patellofemoral pain syndrome, and then I'll tell you about these braces. When it comes to patellofemoral pain syndrome, you have to think about the mechanics of this problem. You're talking about pain in the front of the knees, and the patella is this kneecap right here, and the femur, patellofemoral, femur is the end of the thigh bone. Where those two bones come together is part of the knee joints, and when they rub together too much with extra force, then you get pain and irritation, possibly even swelling in the area. And that is what causes patellofemoral pain syndrome. Now, most healthcare professionals out there will say you're doing too much. This is an overuse injury. In other words, you're running too much, you're playing too much sports. But how is it that all your peers are doing the same thing? Or there's people that are doing even more. If you're a runner dealing with this problem and you're running, say, 5Ks and 10Ks, how do marathon runners get away with this and not have patellofemoral pain syndrome? The answer is they're wrong. The doctors are wrong in telling you that the source is an overuse injury. The way that I look at this problem is that it's a muscle imbalance. It's that your muscles are imbalanced in a way where the quads that are on the front of the thigh, the same muscles that come down and attach to the kneecap, those muscles are too strong and too overdominant, and so they're yanking the kneecap up and against the thigh bone. So it's causing too much compression. If you hold it compressed like that and then you go do your activity, you're running, you're weightlifting, your whatever sport, or even if you're just not even active, even if you just go walk around, but on a compressed kneecap against your thigh bone, it's going to become irritated. So then that means that the root of the problem lies in correcting the muscle imbalance. When it comes to the knee braces, all of these give compression, and then the ones that have the struts and the hinges, they can offer stability to the knee. But what they don't do is take pressure off the kneecap by correcting the muscle imbalance. So it's important to have a healthy understanding of what each of these braces is for, what their intent is. Because if you're putting on a knee brace, a sleeve like these, or one of these supports that has more stability offerings in it, you can't expect it to fix the root problem. Let me just overview each brace for you and tell you how you might be able to use it in case you are looking for help from a brace. So this is just a knee sleeve. There's no supports on the side, and this one does not have a hole for the kneecap, but it's got a change in the fabric here so that you know where your kneecap is supposed to go. And you would just slide it over your leg, and the compression of the sleeve on your leg, the sensation of the compression is supposed to kind of distract you from the pain, and so it might give you some temporary pain relief. But because the muscle imbalance is still there, it happens very commonly that this sleeve only works for a short time. It only gives you relief for days, maybe weeks at best. And then even though you have the knee sleeve on, it's still going to hurt your knee because the patellofemoral pain syndrome is rooted in a muscle imbalance, and giving compression from a sleeve like this is not going to fix the root problem. But I like this if you're trying to avoid medications and if you're trying to avoid going to the doctor for injections, and definitely trying to figure out a way to give you some relief so that you can do the things that are going to help you fixing that muscle imbalance. Now here we have a knee brace that has struts on the side. These plastic struts are bendable plastic material that I can easily bend with my fingers, so it doesn't really give a ton of stability, which offers more flexibility than anything else. But it does offer more rigidity than the sleeve. So for those of you that have a lot of sports or activities where you're changing directions, this might feel like it gives you a bit more relief because it slightly restricts your motion and gives you that stability. Now the compression factor is still there, so you're getting some relief from the compression. And then it does have this hole for the kneecap, which I think is kind of a waste of time because the kneecap moves. I mean, you could stand up and squeeze your quads and your kneecap will just shift up slightly, which will put it out of position of the hole. But they do this just to kind of make you believe that it's going to help your kneecap somehow. And then lastly, we have the brace that has the hinges. This is a heavier duty brace, and these can offer quite a bit of stability because you can't see the metal parts in there, but they don't give much. They have a little bit of give, but I mean, it's gonna take me a lot of force to try to bend that. The only place that metal part bends is at the hinges. You have double hinges inside. That the reason for the double hinges is it mimics how the knee bends, because the knee is kind of an awkwardly shaped hinge joint. But once you have this on, it gives you tons of compression. This is probably the most compressive knee brace of all the three that I've shown you. The fabrics and materials are just more dense, more thick materials. They're gonna give you a lot more compression. Plus the straps are heavier duty. But then the stability from the braces and hinges on the sides is the best so far. If you have like a meniscus problem or a ligament issue, like an old ACL injury, or you have a current ACL tear, partial tear, if you're dealing with some ligament problem, MCL tears also happen, then this brace is going to be more beneficial for helping your knee pain from patellofemoral pain syndrome. But once again, you still have to fix the root problem, the muscle imbalance, in order to fix your patellofemoral pain syndrome for the long term. This brace is only going to offer you short-term relief. And you can go exercising. These things are not the most comfortable. They slide down. You have to twist them and pull them up in the right position so that it's most comfortable, but they're just not the most comfortable to wear, especially in the hotter months of the year, or if you're in more wet climates or hot climates, you're going to be sweating. You got to be washing these things, otherwise it's not pleasant. Now, if you want to fix the root problem of your patellofemoral pain syndrome, you need to go after addressing the muscle imbalance. I have my comprehensive treatment approach called the Patella Pain Recovery Program. It's all recorded into 30+ videos that you can access on demand anytime you want, so that you can see the videos where I walk you through step by step how to address the root muscle imbalance that leads to patellofemoral pain syndrome. This, in my opinion, is what fixes it for the long term, because if you go through the whole program, you get confidence in your knee to go back to running and jumping and weightlifting activities, or even just your normal everyday activities with confidence that you're not going to irritate your knee and have to pay for it the next day and deal with swelling, because you're fixing the root of the problem. You're addressing the weaknesses that are causing the muscle imbalance, and that is allowing you to take pressure off your kneecap so that you're not irritating it more. I've also got lots of videos here on YouTube to help you out with patellofemoral pain syndrome and other patella or kneecap related problems. I've linked them in the description below. You can go check those out for advice, exercises, and tips that you can do right now today and learn about how to help yourself. Hey friends, thanks for watching this video. If it was helpful for you, please give us a thumbs up. If you thought that this is share worthy, please share this with somebody that is dealing with a knee problem so they can understand how to properly use braces and set their expectations for knee supports like this so they can get the right kind of help. If you haven't already, subscribe to our channel and hit the notification bell so that you don't miss out on any of the videos that we'll be posting in the near future here. And please drop comments, ask questions. We love to get back to our questions here on YouTube. Thank you so much, friends, and I'll see you in the next video. Bye-bye.